Hi, I'm going to discuss on the pharmacology of parasympathomimetics. After completion of this chapter, the student should be able to classify the parasympathomimetic drugs, explain the mechanism of these drugs at the receptor levels, analyze the pharmacological actions of these drugs, focus on the pharmacological knowledge in the prevention and treatment of ailments. The contents discussed in this chapter are introduction, synthesis of acetylcholine, cholinergic receptors, definition, classification, pharmacological actions, adverse effects, and uses of parasympathomimetics. Introduction. The neurotransmitter released by the parasympathetic nervous system is acetylcholine, which is mainly involved in the parasympathetic or cholinergic nerve transmission. So this parasympathetic nervous system is stimulated during the rest or digest response. It is also referred to as craniosacral outflow, where the nerve emerges from the nerve cells that is located in the 3rd, 7th and 9th cranial segments and also from the 2nd, 3rd and 4th sacral segments. Now we will discuss how this acetylcholine is released or synthesized from the nerve terminal. Acetylcholine is synthesized from the acetyl coenzyme A and choline. The choline enters into the cholinergic neuron by carrier-mediated transport mechanism. It reacts with the acetyl coenzyme A and the reaction is mainly catalyzed by an enzyme, choline acetyl transferase. This acetylcholine is stored in the small vesicles, that is synaptic vesicles in the cholinergic nerve terminals. When an action potential, that means when an impulse reaches the presynaptic membrane, acetylcholine is released into the synaptic cleft. So synaptic cleft is the space between the presynaptic membrane and the postsynaptic membrane, and in this synaptic cleft, acetylcholine is released. This acetylcholine binds to and activates the cholinergic receptors on postsynaptic membrane that leads to the depolarization of this membrane. So some of the acetylcholine binds to the receptors, whereas some of the acetylcholine is destroyed by the enzyme acetylcholine esterase into choline and acetate. This choline is taken actively uptaken by the axonal membrane by a Na plus choline co-transporter, where it is recycled to produce the acetylcholine again. Cholinergic receptors. So there are two types of receptors. One is muscarinic receptors. The other one is the nicotinic receptors, where this acetylcholine binds and produces its action. So muscarinic receptors is the type of G protein coupled receptors which is mainly present in the heart, smooth muscle, glands, eye and CNS. Muscarinic receptors has been divided into 5 types, that is M1, M2, M3, M4, M5, where this M1 is located in the autonomic ganglia, gastric glands, CNS, where M2 is present in heart, nerves, smooth muscles, where M3 is present in glands, smooth muscle, eye, M4 and M5 is mainly present in the central nervous system. This nicotinic receptors is the type of ion channeled receptors. It is mainly present on the neuromuscular junction, autonomic ganglia and adrenal medulla. It has two types, one is NM and NN. NM is mainly located in the neuromuscular junction, whereas NN is present in the autonomic ganglia, adrenal medulla and CNS. Definition of the parasympathomimetic drugs. It is also called as cholinergic drugs or cholinomimetics. These are the drugs which produces similar actions of the acetylcholine, either by directly interacting with the cholinergic receptors, which is termed as cholinergic agonist, or by increasing the availability of the acetylcholine at these sites, that is anticholine esterase. So either it reacts with the cholinergic receptors, that is muscarinic receptors or nicotinic receptors, or by increases the availability of the acetylcholine by inhibiting the enzyme cholinesterase. Classification. It has been divided into two types, that is cholinergic agonist and anticholinesterase. So under cholinergic agonist you have cholinesters and cholinergic alkaloids. So under cholinesters the drugs used are acetylcholine, methacholine, carbachol, methanacol. So under cholinergic alkaloids you have muscarine, pilocarpine, aricoline. So anticholinesterases has been divided into reversible and irreversible. So under reversible you have carbamines, that is physostigmine, neostigmine, pyrostigmine, rivastigmine. Whereas in non-carbamates you have hydrophonium, chacrine, donepezil, galantamine. Irreversible includes carbamates, that is carbaryl and propaxone, whereas organophosphates contains difluorous, ecothiopate, malathion, diacinon, sabun, sarin, soman. Cholinesterase. So these are the drugs that act or mimics like acetylcholine at all sites, but they are resistant to the degradation by the enzyme acetylcholine esterases. So pharmacological actions taking acetylcholine as a prototype. So first one is the muscarinic action, and under that you have particularly on the heart. Acetylcholine acts on the M2 receptors and produces hyperpolarization of the SC node. As a result of this, the rate of impulse generation is reduced, that leads to bradycardia and sometimes even cardiac arrest may occur. At AV node, Purkinje fibers, the refractory period is increased and conduction is slowed. Blood vessels. Acetylcholine acts on the M3 receptors. It relaxes the vascular smooth muscle and dilates the blood vessels. So this vasodilatation is mediated through the release of the endothelium dependent releasing factor, that is nitric oxide. So once nitric oxide is released, it leads to the vasodilatation. Smooth muscle. So acetylcholine produces its action by acting on the M3 receptor. It mainly enhances the tone and peristaltic movement of the GIT. It contracts the smooth muscles of the gallbladder, ureter and bronchiole, whereas it relaxes the smooth muscles of the trigonal sphincter. Glands. So acetylcholine acts on the M3 receptors and sometimes it may act on the M2 receptors also. So the main action is increased secretions. That means the secretions such as sweating, salivation, gastric, bronchial and lacrimal are increased. The effect on the pancreatic and intestinal glands is not marked, whereas the secretion of the milk and bile is not affected by the acetylcholine. Now pharmacological action on the eye. It produces contraction of the circular muscle of iris that results in the miosis. Contraction of ciliary muscle causes spasm of accommodation, increased aqueous outflow facility, reduction in the intraocular tension, especially in the glaucomatous patients. Now coming to the nicotinic action of the acetylcholine. So in autonomic ganglia consists of NN type of receptor and it is mainly innervated by sympathetic and parasympathetic nervous system. So stimulation or activation of both sympathetic and parasympathetic ganglia results in release of the acetylcholine and noradrenaline. So noradrenaline is a catecholamine released by the adrenergic nervous system. So next on the neuromuscular junction. The neuromuscular junction of skeletal muscle consists of NM type of receptors. So this acetylcholine opens the sodium and potassium ion channels and increases the ion permeability that leads to the persistent depolarization of skeletal muscle. So this produces twitching, spasm and finally paralysis of the skeletal muscle. Then acetylcholine reaction on the central nervous system. So acetylcholine when injected IV does not penetrate into the blood-brain barrier and no central effects are seen. But direct injection of the acetylcholine into the brain produces arousal response followed by the depression. That is stimulation followed by the depression. So the cholinergic drugs which enters into the brain produces complex behavior and neurological effects. So now we will move on to the adverse effects. It includes diarrhea, salivation, sweating, bradycardia, hypotension. Uses. So it is rapidly destroyed in the gut when given orally. So when it is given through the intravenous route, it is metabolized by the pseudocholine esterase in the plasma and true choline esterase at the site of action, and it is not used therapeutically. It is also used in cataract surgery and iridectomy, that is surgical removal of the iris, and also used in acute angle glaucoma and also used in keratinoplasty, that is surgical removal of the diseased cornea. Next, we will move on to the cholinomimetic alkaloids. So under that, we are going to discuss about the pilocarpine. So pilocarpine is a drug that has been obtained from the leaves of the Pilocarpus microphyllus and other species. Its pharmacological actions include, it has prominent muscarinic action and also stimulates the ganglia. The secretions produced by the pilocarpine are increased sweating, salivation and also increases the other secretions. In CVS, small doses generally cause fall in BP by acting on the muscarinic receptors, but higher doses produces rise in BP and tachycardia, which is mainly due to the ganglionic stimulation. So in eye, It penetrates the cornea and promptly causes miosis, ciliary muscle contraction, and fall in the intraocular tension that lasts for about 4 to 8 hours. Adverse effects of this drug is diminution of the vision, especially in the deep night, spasm of accommodation, and brow pain are frequent side effects. The systemic effects include nausea, diarrhea, sweating, bronchospasm may occur with higher concentration of the eye drops. So uses. So this drug is mainly used as the eye drops at a concentration of 0.5 to 4%. It is particularly used in the acute open angle glaucoma. It is also used as miotics in order to counteract the mydriatics after they have been used for testing refraction. Also to prevent or break adhesion of the iris with lens or cornea by alternating it with mydriatics. So next we will discuss about the anticholinesterases. So these are the agents that inhibit the cholinesterase enzyme, and also it protects the acetylcholine from hydrolysis. It produces cholinergic effects in vivo and potentiate the acetylcholine both in vivo and in vitro. Pharmacological actions include the lipid-soluble agents, that is physostigmine and organophosphate, have more marked muscarinic and CNS effect. It also stimulates the ganglia, but action on skeletal muscle is less prominent. Lipid-insoluble agents, that is neostigmine and other quaternary ammonium compounds, produces more marked effect on the skeletal muscle and stimulate the ganglia, but muscarinic effects are less prominent. But that means it produces more effect only on the skeletal muscles and the less effect on the muscarinic receptors. They do not penetrate CNS and so they have no central effects. In ganglia, it stimulates and through muscarinic receptors. High doses causes persistent depolarization of the ganglionic nicotinic receptors and blocks the transmission of impulse. In CVS, muscarinic action would produce bradycardia and hypotension. Ganglionic stimulation would tend to increase the heart rate and blood pressure. At higher doses, it blocks the ganglia, and at moderate doses, the bradycardia and the small rise in BP are common. Skeletal muscles. So after treatment with anticholinesterases, the acetylcholine released by a single nerve impulse is not immediately destroyed. It rebinds to the same receptor, diffuses to act on the neighboring receptors, and causes retrograde activation of pre-junctional fibers. This results in the repetitive firing that leads to twitching and fasciculations. Higher doses causes persistent depolarization of end plates that results in the blockade of neuromuscular transmission that gives rise to weakness and paralysis. Pharmacological actions at central nervous system. At higher doses, it produces excitement, mental confusion, disorientation, tremors, and convulsions followed by the coma. The other effects produced by this anticholinesterases are it stimulates the smooth muscles and glands of the gastrointestinal, respiratory, urinary tract, enhanced GI motility and secretion, bronchoconstriction, and increased airway secretions, voiding of the bladder due to detrusor muscle contraction with trigone and sphincter relaxation, meiosis, and ciliary muscle contraction that leads to lowering of the intraocular tension in glaucoma. The uses of this include physostigmine at a concentration of 0.1% is used only to supplement pilocarpine. They are effective in aphakic glaucoma. Pilocarpine along with other drugs is used in angle closure glaucoma. So thank you for listening.